It's Patrik Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today's tip is answering a question from another reader who says, my mum is in ICU and BIPAP and her CO2 level is 55 and she's lethargic and sleeping all of the time. She wakes up occasionally when spoken to. What should I be looking out for, especially in view of getting rid of the BIPAP? Well, that's a fantastic question, and I'm glad you're asking it. So when patients are in ICU on BIPAP, it's often a sign of respiratory failure, and it's often, or it can be a sign of type 2 respiratory failure. So type 1 respiratory failure is low oxygen levels, and type 2 respiratory failure is high CO2 levels. And it sounds like your mum might have type 2 respiratory failure of unknown cause. You haven't shared whether she's got a history of COPD, whether she's got history of asthma, whether maybe she overdosed on some opiates. You haven't shared any of that. But the reality is that if CO2 levels are high, around 55 centimeters of water, about around 55 millimeter per mercury, that she might be drowsy. Normal CO2 levels are 35 to 45 millimeter per mercury, and 55 is too high. Some patients with COPD or asthma have a high baseline, i.e. their CO2 level is higher to begin with. Their baseline CO2 might be around 50. So, but given that your mum is sleepy, she probably has a normal CO2 baseline. The other thing that you got to look out for is she on opiates such as morphine, fentanyl? Is she having any other sedatives? Is that potentially a reason for her sleepiness? Because if she has a high baseline CO2, it could as well be the medications that she's getting that's making her sleepy, because her CO2 might be high to begin with. Those are questions you should be asking. Now, other things to get CO2 down. Let's assume your mum doesn't have a high baseline CO2. Let's just say your mum's CO2 baseline is normal. Why is it so high? You should be looking out for how much BiPAP are they giving her. What's her PEEP? What's her pressure support? And if CO2 is too high, maybe they need to increase PEEP and pressure support to get CO2 down. But also, as I said, maybe they need to stop any opiates that she may or may not be getting, any sedatives that she may or may not be getting. So, other things that should happen if your mum is awake is physical therapy or physiotherapy, breathing exercises. Ideally, mobilization should happen. Other things you need to look out for when someone is on BiPAP is aspiration risk. So if your mum is drowsy, she might have a nasogastric tube to get feeds and nutrition through the nasogastric tube. And if she's drowsy, there's definitely an aspiration risk as well. Now, the last thing that you want for your mum is that she's aspirating when she's on BiPAP, because that's the next step. There is often that patients are going to be intubated or have the breathing tube inserted and be put on a ventilator and go into an induced coma. And that is not what you would want for your mum. Next, you should be looking out for chest X-ray results, of course. You should be looking out for arterial blood gases. We know that CO2 is around 55 millimeter per mercury, but what's PO2, for example? And then in order to get CO2 down, again, PEEP and pressure support probably need to be increased. Hopefully they're not very high to begin with, so that there's room to move. Again, if there's no room to move, they probably will start thinking about intubating your mum, and that wouldn't be good. You gotta keep your mum off the ventilator with the breathing tube if you can. Other things you should be looking for is, is she continuously dependent on the BiPAP, or can she have time off the BiPAP? So for example, can she have 2 hours on the BiPAP, 2 hours off the BiPAP? So you're talking about a CO2 of 55 millimeter per mercury. When is that being measured? Is that being measured while she's on BiPAP? Is that being measured while she's off the BiPAP? You got to put things in perspective when it comes to CO2 levels whilst on BIPAP. So I hope that helps to answer your questions around BIPAP for your mom in ICU. Now, if you have a loved one in intensive care, go to intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com. Also, have a look at our membership for families in intensive care at intensivecaresupport.org. There you have access to me and my team 24 hours a day, and we answer all questions intensive care related. Also, if you need a medical record review for your loved one in intensive care or after intensive care, especially if you suspect medical negligence, or if you just simply need medical information translated into normal language, we can help you with that by reviewing medical records. Please contact us as well. Subscribe to my YouTube channel for regular updates for families in intensive care. Share the video with your friends and families. Click the like button, click the notification bell, and comment below what you want to see next or what questions and insights you have from this video. Thanks for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days.